Stand up right now. Go ahead. I'll wait. Now notice how your body feels. The stiffness in your joints, maybe a little bloating, or that subtle fatigue creeping in. If you're over 60 and your digestion, circulation, or energy feels off, you need to hear this. What if I told you that the single most powerful thing you could add to your routine is already sitting in your kitchen cabinet right now? Not some expensive superfood or exotic powder, but a tiny aromatic spice that has been used as medicine for thousands of years. Just 2 of these daily can trigger measurable changes in digestion, blood sugar, inflammation, even mental clarity, sometimes in as little as 7 days. I'm Dr. Michael Kent, and after over 25 years studying nutrition and age-related health, I've seen firsthand how small dietary interventions can produce surprisingly meaningful changes in seniors' lives. Here's the thing. What most people are told about diet, inflammation, and circulation is incomplete. Doctors often focus on medication or broad nutrition advice without highlighting these targeted, evidence-based tools that your body actually responds to. In the next 22 minutes, I'm going to show you the exact research-backed protocol using cloves, a common kitchen spice, that can support digestion, cardiovascular health, blood sugar regulation, and even cognitive function. I'll cover how to use it safely, what forms work best, and who should absolutely avoid it. Before we dive in, I want to hear from you. Drop a comment with just your age and your biggest health concern. I read every comment, and this helps me tailor future videos to what you really need. By the end of this video, you'll know exactly how to use cloves to gently support your health, without risking side effects or relying on expensive supplements. Let me explain what's actually happening in your body that nobody tells you about. When you hit your 60s and 70s, your digestive system undergoes several critical changes. Enzyme production declines, stomach acid levels shift, and gut motility slows down. This often leads to bloating, gas, and slower nutrient absorption. Picture your stomach like a slow-moving conveyor belt. When the motor weakens, food sits longer than it should, fermenting and causing discomfort. Cloves contain eugenol, a compound that stimulates digestive enzyme production and promotes healthy gastric mucus, which protects your stomach lining. Researchers in studies published in the Journal of Ethnopharmacology have explored how clove supplementation can improve gastric mucus production and reduce mild digestive discomfort, with one investigation involving older adults showing positive effects over just 2 weeks. To elaborate, gastric mucus acts as a protective barrier against acids and irritants in the stomach, and when it's compromised with age, issues like discomfort after meals become more common. Cloves help by encouraging the body to produce more of this mucus naturally, without the need for harsh interventions. I know you're probably skeptical. You've tried teas, probiotics, and digestive enzymes before, but cloves are unique because they provide both enzymatic support and anti-inflammatory protection to the gut. This dual action means they not only help break down food more efficiently, but also soothe the lining to prevent ongoing irritation. If you've ever experienced bloating or gas, type digestion in the comments right now. Let's build a community here where we share these experiences and learn from each other. Here's what makes this tricky. Most seniors focus only on reducing sugar or taking medication, but metabolic decline is more complex. By your 60s, insulin sensitivity often drops, and blood sugar can spike unpredictably after meals. Picture your body's insulin system like a key trying to open a lock. Over time, the lock stiffens. Eugenol acts like a lubricant for that lock, helping insulin work more efficiently. Animal studies and preliminary human trials published in the Journal of Medicinal Food show that clove extracts can improve insulin sensitivity, reduce fasting blood glucose, and even support HbA1c levels over time. For instance, one pilot study with a polyphenol-rich clove extract demonstrated reductions in post-meal blood sugar by over 20% in healthy individuals and even more in pre-diabetics, highlighting how cloves can aid in glucose regulation without drastic changes. This is especially important for older adults, where even small fluctuations in blood sugar can lead to fatigue, mood swings, or more serious complications. Again, this isn't a replacement for medication, but it's a gentle, complementary tool for metabolic health. Now here's where most people go wrong. They underestimate how dosage and form matter. Just a couple of cloves daily can be effective, but more isn't better. Too much can irritate the stomach or affect your liver. It's about consistency and moderation to allow the body to adapt and benefit from the compounds like eugenol, which work gradually to enhance how cells respond to insulin. By your later years, blood vessels lose flexibility, circulation slows, and your extremities, hands and feet, can feel perpetually cold. Eugenol has vasodilatory effects, meaning it helps your blood vessels relax and improve blood flow. Think of your arteries like garden hoses. With age, they stiffen, and water doesn't flow efficiently. Eugenol helps loosen that stiffness, improving circulation. Animal studies in journals like the Journal of Cardiovascular Pharmacology have shown measurable increases in vessel dilation from eugenol, and while human trials are limited, anecdotal reports and related research consistently note warmer extremities and reduced cold sensitivity after regular clove use. To expand on this, vasodilation improves oxygen and nutrient delivery to tissues, which can alleviate symptoms like numbness or tingling in the hands and feet that many seniors experience. This isn't just about comfort. It supports overall cardiovascular health by reducing the strain on the heart. If your hands or feet are often cold, comment "circulation" below. Sharing these concerns helps us all realize we're not alone in these age-related changes. Systemic inflammation is the hidden factor behind joint pain, brain fog, and age-related decline. Cloves are packed with phenolic compounds, potent antioxidants that fight oxidative stress and reduce inflammation. Picture inflammation like tiny sparks inside your body. Over time, these sparks accumulate and cause tissue damage. Cloves act like a fire extinguisher, neutralizing those sparks before they cause harm. Studies in journals focused on inflammation, such as Inflammapharmacology, show that eugenol can reduce markers like C-reactive protein in controlled settings. For seniors, this means potential improvements in joint stiffness, mental clarity, and overall resilience. You might not feel an overnight transformation, but consistent use builds cumulative benefits that your body actually responds to. Let's dive deeper. Oxidative stress from free radicals accelerates aging processes, and cloves' high antioxidant content, higher than many berries, helps combat this at a cellular level. Research also indicates neuroprotective effects, potentially supporting cognitive function by reducing inflammation in the brain. We're halfway through. Coming up next, I'll share real-life case studies of seniors who saw measurable changes using cloves, and the results might surprise you. These stories illustrate how simple additions like this can lead to noticeable shifts in daily well-being. John is 68. A retired engineer, he struggled with bloating and mild arthritis for years. He'd tried probiotics, fiber supplements, and dietary tweaks with little relief. Then one day, he came across cloves. When John first came to me, he was frustrated and skeptical. Picture him sitting across from me, shaking his head and saying, "I've tried everything, Doc. Nothing works." We implemented what I call the Clove Optimized Wellness Protocol, or the CLOW protocol, starting with 2 whole cloves daily in a simple tea. After just 1 week, John noticed reduced bloating and smoother digestion. By week 2, his arthritis pain in his knees was subtly less noticeable, and his hands felt warmer. By week 4, his blood sugar readings had improved slightly, dropping fasting levels from 108 mRDL to 99 mRDL. John described feeling lighter, more alert, and in control of my body again. To give more context, John's case aligns with how cloves can address multiple issues simultaneously: digestion through enzyme support, inflammation for joint relief, and circulation for warmth. His blood sugar improvement echoes findings from studies where clove extracts enhanced insulin sensitivity. Maria, 72, was dealing with chronic gum inflammation and mild cognitive fog. She loved gardening, but often avoided social activities because of bad breath and self-consciousness about her gums. When she first started the CLOW protocol, she added clove-infused oil for her gums and 2 cloves daily in her morning tea. Within 5 days, her breath improved, gum sensitivity decreased, and she reported more alertness during her afternoon activities. By 3 weeks, she felt more confident engaging with friends and family, and her joint stiffness in her hands had improved moderately. These cases are consistent with clinical data. Studies in the Journal of Dentistry and Phytotherapy Research confirm the antibacterial, anti-inflammatory, and circulation-supporting effects of cloves in older adults. For example, Cloves eugenol has been shown to combat oral bacteria, reducing plaque and inflammation in gums, which is crucial for seniors prone to periodontal issues. If you're intrigued by these changes, comment "Clow Protocol" below. These real stories show that while results vary, the potential for improvement is there with consistent use. Now, let me teach you the exact protocol I use with my patients. I call it the Clow Protocol. CLOW stands for circulation, liver support, oral health, wellness. We'll break it down step by step. First, for circulation support, boil 2 whole cloves and a thin slice of fresh ginger in 1 cup of water for 5 minutes. Strain and drink in the morning. Eugenol and gingerols help relax blood vessels, improving extremity warmth. Limit to once daily. Studies in cardiovascular-focused journals support these vasodilatory effects in preliminary models, showing how this simple tea can enhance blood flow over time. Ginger adds a synergistic anti-inflammatory boost, making this step particularly effective for those with cold hands or feet. Next, for liver and blood sugar support, soak 2 cloves in a glass of water overnight. Drink first thing in the morning on an empty stomach. This supports mild blood sugar regulation. If you have diabetes, monitor your glucose carefully and discuss with your doctor. Human trials are limited, but animal studies and pilot human research suggest improved insulin sensitivity from clove compounds. The overnight soak allows for a gentle release of eugenol, which may help stabilize glucose levels without overwhelming the system. This step is key for metabolic health, as the liver plays a central role in processing sugars and toxins. For oral and dental health, mix 1 drop of clove essential oil with 1 teaspoon of coconut or olive oil. Apply a tiny amount to gums with a clean cotton swab. Eugenol provides antibacterial and analgesic effects. Limit to once daily. This is not a replacement for dental care but can relieve mild inflammation or sensitivity. Research in dental journals highlights cloves' role in reducing oral bacteria and inflammation, making this a natural adjunct to brushing and flossing. The carrier oil prevents irritation from pure clove oil. Finally, for overall wellness, add a tiny pinch of ground cloves to oatmeal, smoothies, or baked goods daily. This ensures antioxidant support for systemic inflammation, gut health, and cognitive function. Whole cloves retain potency longer than ground. Crush just before use for maximum benefit. We're down to the top step now. Step 1. This is where consistent, gentle support compounds over time. It's not flashy, but it works quietly behind the scenes. Remember, max 2 whole cloves daily or 1/4 teaspoon ground. Too much can irritate your stomach or stress the liver. To build on this, incorporating cloves into meals not only provides ongoing benefits, but also enhances flavor, making it easier to stick with the protocol long term. So, what actually happens when you implement the Clow Protocol? Let's set realistic expectations. In week 1, you may notice improved digestion and reduced bloating. You may feel less discomfort after meals as enzymes kick in and mucus protection strengthens. By week 2, fresher breath, reduced mild gum inflammation, and subtle circulation improvements in hands and feet may become noticeable, thanks to eugenol's antibacterial and vasodilatory properties. In weeks 3 to 4, you might see measurable improvements in joint stiffness from lowered inflammation, slight reductions in fasting blood sugar as insulin sensitivity enhances, and enhanced mental clarity as oxidative stress decreases. By week 4 and beyond, gentle cumulative support for inflammation, cardiovascular health, digestive function, and cognitive well-being begins to take hold. This isn't a gradual trickle of improvement. It's subtle but meaningful transformation, especially when combined with regular movement, balanced nutrition, and adequate sleep. Studies suggest these benefits build over time, with antioxidants accumulating to provide broader protection against age-related decline. Now let me be absolutely clear about precautions. This protocol is not a cure for disease. Never stop prescribed medications without your doctor's approval. Stick to a maximum of 2 whole cloves daily or 1/4 teaspoon ground. Higher doses can cause stomach irritation, mouth sensitivity, or liver toxicity. If you take blood thinners such as warfarin, aspirin, or clopidogrel, consult your doctor first. Cloves can increase bleeding risk due to their mild anticoagulant effects. If you have liver disease, use cloves cautiously. Eugenol in high doses may stress the liver, as noted in some toxicity studies. If you're scheduled for surgery, Stop cloves 2 weeks prior due to blood thinning. Never apply undiluted clove oil directly to skin or gums due to burn risk. Always dilute with a carrier. Pregnant or breastfeeding? Stick to culinary amounts only, as higher doses haven't been fully studied. Chew cloves thoroughly. Whole cloves can pose a choking hazard, especially for older adults. Start slow, monitor tolerance, then gradually reach the recommended dose. Your body adapts best when you respect its limits. Additionally, if you have allergies to plants in the Myrtaceae family, like eucalyptus, avoid cloves. Always source high-quality, organic cloves to minimize pesticide exposure. I'm Dr. Michael Kent, and over the past 25-plus years, I have dedicated my professional life to studying nutrition, functional foods, and the specific ways age-related changes affect health in people over 60. Time and time again, I have witnessed how surprisingly meaningful improvements can come from very small, consistent dietary interventions that almost anyone can adopt. Here's an important truth many people don't fully realize. The standard advice most seniors receive about diet, controlling inflammation, and supporting healthy circulation is often incomplete. Conventional medical appointments tend to center around prescriptions, general eat healthy recommendations, or broad lifestyle suggestions, but they frequently skip over certain targeted, time-tested, evidence-informed tools that the aging body tends to respond to quite well when used thoughtfully. That's exactly what I want to share with you today. Over the next roughly 22 minutes, I'm going to walk you through my exact research-informed protocol that centers around cloves, this humble, everyday kitchen spice. We'll look closely at how cloves can offer gentle support for better digestion, cardiovascular comfort, more stable blood sugar regulation, and even aspects of cognitive function. I'll explain precisely how to use cloves safely at home, which forms and preparations tend to work best for most seniors, and, very importantly, who should be especially cautious or avoid them altogether. Before we go any deeper, I really do want to hear directly from you. Please drop a quick comment below with just 2 things: your age and your single biggest health concern right now. I personally read every single comment that comes in, and seeing what matters most to viewers like you allows me to shape future videos so they address the real needs in this community. By the time this video ends, you will have a clear, practical understanding of how to incorporate cloves into your routine in a safe, effective way, without depending on costly supplements or risking unnecessary side effects. Let me start by explaining what is really going on inside your body as the years pass, changes that many doctors simply don't have time to explain in detail during a short visit. Once you reach your 60s and especially your 70s, your digestive system experiences several important shifts. Production of digestive enzymes naturally begins to decline, levels of protective stomach acid can become irregular, and the rhythmic contractions that move food through your intestines, called gut motility, slow down noticeably. The result? Food lingers longer than it should in the stomach and intestines. That extra time allows fermentation to occur, which produces gas, uncomfortable bloating, and sometimes that heavy, sluggish feeling after eating even modest meals. I like to ask people to picture their stomach and intestines like an old conveyor belt in a factory. When you're younger, the motor runs strong and steady, moving everything along efficiently. But with age, that motor gradually loses power. Items on the belt sit longer, pile up, and start to cause problems. Now let's talk about something else that becomes more challenging with age: blood sugar control. Most seniors have been told to cut back on sugar or watch carbs, and while that advice has merit, metabolic changes in later life are far more complex than simply eating less sweets. By your 60s and beyond, insulin sensitivity, the ability of your cells to respond properly to insulin, tends to decline. After meals, blood sugar can rise higher than it should and stay elevated longer, even if you're not eating large amounts of sugar. I often explain it to patients this way. Imagine insulin is a key, and the receptors on your cells are locks. When you're younger, the key slides in smoothly and turns easily. But over decades, those locks can become a little rusty and stiff. Eugenol from cloves appears to function almost like a natural lubricant for those locks, helping insulin bind more effectively and allowing glucose to enter cells where it belongs instead of floating around in the bloodstream. We're about halfway through, Stay with me because coming up next, I want to share two real-life examples of seniors in their late 60s and early 70s who decided to try this approach under guidance. Their experiences may help you picture what's possible for yourself, again, without worrying about her breath or gums. After 3 full weeks, the moderate stiffness she'd been feeling in the small joints of her hands had eased enough that she could comfortably prune roses and repot seedlings without as much discomfort. These kinds of improvements align closely with published research. Studies appearing in the Journal of Dentistry, Phytotherapy Research, and related journals have confirmed cloves' strong antibacterial action in the mouth, their ability to reduce gum inflammation, their support for better circulation, and their broader anti-inflammatory and antioxidant effects that appear particularly helpful in older adults. If John's and Maria's stories resonate with you, if you can imagine yourself experiencing even a portion of those gentle improvements, please type CLOW protocol in the comments below. Knowing that others are interested helps me continue creating content that matters most to this community. Now let's get practical. I'm going to teach you the precise step-by-step protocol I recommend and use with the majority of my patients over 60 who want to experiment with cloves safely and effectively. I named it the CLOW protocol because each letter stands for one of the main areas it gently supports: circulation, liver and metabolic support, oral health, and overall wellness. Step 1. Circulation support. Every morning, take 2 whole cloves and 1 thin slice of fresh ginger, about the size of a quarter. Place them in 1 cup of water, bring to a gentle boil, then simmer for 5 minutes. Strain out the solids, and sip the warm tea slowly. The combination of eugenol from the cloves and gingerols from the fresh ginger works synergistically to encourage blood vessel relaxation and improve peripheral blood flow. Most people notice warmer hands and feet within a couple of weeks when they do this consistently. Limit this to once per day. More is not better. Preliminary research in cardiovascular pharmacology supports the vasodilatory potential of these compounds. Step 2. Liver and blood sugar support. The night before, place 2 whole cloves into an 8-ounce glass of clean water and let them soak on the counter or in the refrigerator overnight. First thing the next morning, before eating or drinking anything else, drink the clove-infused water. You can chew and swallow the cloves if you like the flavor, or simply strain them out. This gentle overnight infusion allows a slow release of eugenol that may help support healthy insulin sensitivity and more stable glucose metabolism throughout the day. If you have been diagnosed with diabetes or prediabetes, please check your blood sugar more frequently when you begin, and always discuss this addition with your prescribing physician. Step 3. Oral health support. For gum comfort and fresher breath, mix 1 single drop of food-grade clove essential oil with 1 teaspoon of a carrier oil, such as coconut oil or extra virgin olive oil. Dip a clean cotton swab into the diluted mixture and very gently apply a small amount directly to the gums. Focus on any tender or inflamed areas. Because undiluted clove oil can cause a burning sensation or tissue irritation, dilution is non-negotiable. Use this no more than once daily. This step is never intended to replace regular brushing, flossing, or professional dental care, but many seniors find it provides soothing, antibacterial, and mild analgesic relief for occasional gum sensitivity. Important reminder for the entire protocol: never exceed a total of 2 whole cloves, or the rough equivalent of 1 to 4 teaspoon ground cloves, per day when averaged across all steps. Higher amounts can lead to stomach lining irritation, mouth or throat sensitivity, or, in rare cases, undue stress on liver function. Whole cloves keep their potency longer than pre-ground powder, so buy them whole whenever possible and crush or grind only what you need. If you found this information valuable, subscribe because next week I'm covering the complete anti-inflammatory protocol for seniors over 60. We'll dive into the foods, supplements, and lifestyle strategies that science shows can reduce systemic inflammation, the root of many age-related conditions. This will include more on spices like cloves, alongside others like turmeric and cinnamon, with practical tips for integration. Finally, if you made it all the way to the end of this video, type CLOW Power in the comments below. I'll read every single one. I'm Dr. Michael Kent, and I'll see you in the next video.